COVID-19 hospitalization rates continue to climb across the Tri-Cities region. Today, Ballad Health said they're treating 311 COVID-19 patients in their hospitals, including 73 people in intensive care and 52 are on ventilators. There are also now 10 pediatric patients with COVID-19 at the Niswonger Children's Hospital. Joining us now is Ballad Health Chief Clinical Officer, Dr. Amit Vashist. Dr. Vashist, thanks so much for your time again today. We appreciate it.
Thank you so much, Josh, for having me.
We have gone in the period of 2 months from having COVID units being closed across your health network to now more than 300 patients. Are you seeing any sign of a plateau or maybe a leveling off in terms of serious cases needing hospitalization?
I think, Josh, the answer so far, unfortunately, is we are not. We don't see any signs of plateauing, unfortunately, as yet. And what we do know is that there are certain strategies, public health measures, low-hanging fruits that can be implemented, and that will help the cases to plateau or decline, which is the community starts getting more and more vaccinated. We implement social distancing very robustly, hand hygiene, masking, especially for school children indoors.
Last week, Ballad Health said we think we could maybe see 400 patients within 2 weeks. Are those metrics still lining up? Are you hearing any new estimates about where we could be within the next week or two?
I think based on our modeling estimates, Josh, we have every expectation that we will reach about 400 patients by next week.
Sobering fact, I know for you all as you are struggling to care for those that you have right now. You mentioned efforts to mitigate, and we're seeing people respond to the vaccine call. Are you pleased with what you're seeing, or are you continuing to be concerned that we're not seeing enough people come forward to get the vaccine?
I think, Josh, the answer is multi-layered. I'm cautious, and I'm also encouraged by the level of uptick in the vaccination. Could we do better? The answer is absolutely yes. So we continue to encourage our team members to, for those of you who have not been vaccinated as yet, please go get your vaccine, get your shot, and help us keep our most vulnerable patients and our community safe.
We're hearing from our viewers talk about possible treatments for COVID-19 involving some, I think it's fair to say, controversial methods of treatment that maybe aren't approved by some doctors, Ivermectin, others. Are you seeing people in our area trying to use alternative methods of treating COVID-19?
Great question, Josh. I'm glad you brought it up. And the answer is absolutely yes. In this part of the world, in our communities, we are definitely seeing an uptick in the use of ivermectin, as well as patient and family requests for that. Now, let me tell a few things about ivermectin. I think it is very important for our community to be educated on it a little bit. And I speak in two capacities, Josh, today, which is number one, I'm also a frontline hospitalist physician. I serve on the front lines of COVID-19 in our hospital, Johnston Memorial Hospital in Southwest Virginia, over the weekends. I'm also a physician executive chief clinical officer at Ballad Health. I've been following the COVID-19 treatment modalities very, very closely. I am a participant and I help chair the COVID-19 treatment panel. As far as ivermectin use is concerned, we are very, very concerned. FDA has clearly said that ivermectin is neither authorized nor approved for either prevention or treatment of COVID-19. The National Institute of Health COVID-19 treatment panel guidelines also have determined that there is clearly insufficient data. I repeat, insufficient data to recommend ivermectin for use in COVID-19 patients. So I would recommend our community to listen to the actual medical experts, folks who are specialists in their profession in the field of medicine, rather than some of these armchair experts who are all over our social media spreading misinformation.
Dr. Vashist, I'm hearing you say you're saying it's not effective against COVID-19. Is it potentially dangerous? And what are the dangers of people who are going out into the non-prescribed market or even into the prescribed market and getting these self-treatments? Are they putting themselves in danger by taking things like ivermectin?
So to put some things in context, Josh, before the pandemic, COVID-19 pandemic, and I'm talking about in the year 2019, we had on an average of about 3,000 to 5,000 prescriptions across the nation for ivermectin through our retail pharmacies. Now, last week alone, there were 88,000 prescriptions written from the retail pharmacies across the United States of America. And I'm not including those local farm supply stores that also supply ivermectin for use in animals. So clearly, the use of ivermectin has skyrocketed, which is directly proportional to the misinformation. As far as unindicated uses of ivermectin are concerned, especially at doses that are not prescribed, we got to worry about several symptoms: gastrointestinal symptoms, nausea, vomiting, diarrhea, dizziness, altered mental status, even death. So we got to worry about a whole slew of things. We urge folks to be very, very cautious, listen to the experts, follow the FDA, the National Institute of Health guidelines around the use of ivermectin. Also, one more thing, the Centers for Disease Control last week issued an urgent email educating medical professionals. There has been a definite, Josh, uptick in cases of poisoning from ivermectin across our hospitals in the United States.
Dr. Amit Vashist with Ballot Health, thank you as always for your time. We appreciate it.
Thank you so much, John.